fair share of lumps and went to the chiropractor quite often. And so I found a great passion to want to help people, and that's what propelled me to become a chiropractor. And so, as I said, I'm excited to be able to talk to you guys and just explain the things that I know so that you guys can implement them into your life if it's something that resonates with you, okay? So first of all, the big thing that I want to talk about, I'm going to talk about 5 principles of health, and we're going to do this in all about 20-25 minutes. So if you need to take notes, write it on the back. And if you want to ask me questions, why don't we save those questions until afterwards, and then I'd be more than happy to address those one-on-one with you or on your next visit, okay? So the first thing that I want to talk about is I want to talk about chiropractic. All of you, most likely, those of you who are patients here in the clinic, came here with the idea of I have back pain and I'd like this back pain to go away. And that's what the majority of people come and see us for. But the big thing that I want you to understand is in chiropractic, we really are focusing with your nervous system. And so if you think of your nervous system consists of your brain, your spinal cord, which runs down, and then all these nerve roots. And these nerve roots go out and communicate with every cell, tissue, muscle, and organ in your body. And so it's so important as you come in as patients to realize and to look beyond the level of back pain. We're here to help you with that, but also want you paying attention to if you're having an issue through the middle portion of your back, that goes out and influences into your stomach. People who have issues with their lower back, with women, it can affect menstrual cycles, it can affect pregnancy, it can affect your bowel, it can affect your bladder. And so those are all areas that are influenced. And as we come up into the neck, it goes and influences your eyes, your ears, the blood supply to your head and your sinuses. And so every aspect of your body has nerve innervation. And at first, when chiropractic first started back in 1895, it started because they thought chiropractic was a cure for deafness. The first guy that received an adjustment, his name was Harvey Lillard, he got adjusted and he'd been deaf for 13 years and instantly his hearing came back. And they thought, holy cow, we've got the cure. And so then they found that they weren't, people's hearing wasn't continually coming back, but people who had high blood pressure, their blood pressure was lowering. People with stomach ailments, their stomachs were functioning better. And it's all because your nervous system is the foundation to your health. Does that make sense? Okay. And so I just like to read this to you. It's quick. It says the communication center. It says Gray's Anatomy tells us that the nervous system controls and coordinates every cell, tissue, muscle, and organ, plus adapts and relates your body to the environment. How does this happen? The intelligence expressed through your nervous system continually sends vitally important messages between your brain and your body via the nervous system, which travels through the body at a rate of 325 miles an hour through 45 miles of nerves. This is your daily communication process that helps you function properly. And listen to these statistics. In a 24-hour span, the communication through your nervous system working together will complete the following tasks. Your heart will beat approximately 103,680 times. It'll pump 2,100 gallons of blood through nearly 62,000 miles of blood vessels. 8 million red blood cells are produced in the bone marrow every second, which translates to over 69 trillion cells in one day. You'll breathe approximately 23,040 times, and you'll exercise about 7 million brain cells. If this communication process is disrupted, if you have a misalignment with your spine affecting your nervous system, this will cause a disturbance with the communication between the brain and the body, altering its ability to complete its enormous daily tasks in an effective manner. Better communication equals better health. Does that make sense? And so when you guys come here for an adjustment, whether it be that you're coming here because you want to get out of pain, or whether it be you're coming here because you want overall whole body health and wellness, chiropractic is going to be able to help you do that. So that's number one that I wanted to talk about. Number two, what I want to talk about is I want to talk about nutrition. Nutrition is one of those things, there's so many different diet fads out there. I'm very basic when it comes to nutritional products. I only endorse really 3 things. An organic multivitamin. Organic, I say, because you can take a multivitamin, but a majority of multivitamins have a bunch of fillers in them. And so they are synthetic, and they're not as able to be utilized by your body. Number 2 is an omega-3. It's a fish oil. You can get a high quality fish oil if you're getting brands from certain places and they taste like fish. They're oxidized. It's not a good product. And so we carry a product called Innate Choice, and it's great for you. The benefits of taking omega-3 are, one, it decreases inflammation in your body. It's good for your heart. It's good for your blood vessels. And so in people who come in, they've even done studies that show that taking higher doses of omega-3 can help decrease the inflammation as well as taking ibuprofen. Okay, and it doesn't have all the side effect. And then the third thing that I recommend is I recommend a probiotic. Probiotics are huge. They've done studies that have found that 80% of your immune system's in your GI. And so if you're eating a good or taking a good probiotic, it's going to help your body be healthier. And so am I critical about taking them every single day? No. Do I take them pretty regularly? Yes. Do I take them more often during those sick months that people are coming in, coughing, sneezing, and everything else? 100%. And they help to help your immune system. Okay? From a nutritional standpoint, biggest thing that I want you to get from that is whole foods are better foods. I just was reading an article today, and it did a comparison of 750 calories worth of different fruits and vegetables compared to 750 calories of gummy bears, soda pop, and on and on. And so when you start looking at those things, today's not about taking away, it's really about adding something. And so if you're drinking several sodas a day, cut one of the sodas out and drink a glass of water. It's going to be that much healthier for you. If you're eating gummy bears rather than having an apple, I know those gummy bears taste good, but eat that apple. And so really look at things in that sense. And I say that, and it's very, very simple. But my biggest approach in helping patients is it's trying to inspire you to make that one change. So I hope at the end of the night, or in the next 15 minutes, you have something that you yourself want to change to better yourself for the long run, something to make yourself healthier. And I'm not saying that I'm perfect. I'm not. I'm the furthest thing from it. I slip and check all the time. I might eat a bunch of junk, but then as soon as and usually over the weekend, and then when I come back to work, I'm hard on myself, and I'm pretty critical about what I do, and I exercise, but I don't do it all the time. It's almost impossible, okay? So that's number 2, is our food that we ingest. Number 3, what I want to talk about is I want to talk about different stretching exercises, and these are things that I want you guys doing, okay? Even though you're young, do them every single day. And you maybe look at it on a level of it's like flossing your teeth. And yeah, that stinks, and you don't do that every single day. But go ahead and try to incorporate this into your life because they're going to help you in the long run, okay? Along with that, I'm going to talk about number 4, and that's rest. We're going to talk about positioning while we're sleeping and things to pay attention to there, okay? So we're going to start off as though I'm in bed resting or sleeping. And so when I wake up in the morning, wake up in the morning and I'm on my back in this position, what we want to start off doing is we're going to do a figure 4 stretch where our ankle's over onto our opposite thigh, okay? This stretches what's called the piriformis muscle out, and it runs through your buttock and right over the top of the sciatic nerve. And I want you to grab onto that knee, and I want you to just pull your shoulder over this, or pull your knee over to your opposite shoulder, okay? You're going to hold that for 20 to 30 seconds. And then you're going to go ahead and you're going to do the same thing to the other side. Okay? So usually when I hit my snooze button, this is what I start to do partway into it. Okay? Then when you go to get out of bed, the thing that we're going to get away from is this type of thing where we kick our legs and we come up. What I want you to do is I want you to contract your core. What I mean by that is drawing your stomach in, and you're going to roll to your side. And you're going to push yourself up into a tight ball. When you kick straight up out of bed, it loads your lower back, and it can start to cause you problems. Okay? Once you're on the edge of your bed, what you're going to do is you're going to put your foot up on the end of the bed, hanging off, or on the edge. And why I want you to do that is we want your knee to be able to bend. Okay? If the knee's not bent, it ultimately locks that knee joint out, and it hurts right behind the knee joint when I'm doing this stretch. And so we want to get that stretch more down into the belly of the hamstring. So we're going to bend the knee slightly. I want you thinking of having an axle running through your hips. And you're just going to lean forward, and you're going to try to put your chin to your toes. Obviously I can't get there, but I feel a really good stretch through the back of my leg. Okay? And then we're going to turn 180 degrees, and we're going to do the same exact thing to the other side. Okay? Knees bent slightly, axle through the hips, and lean forward. All right? And then what we're going to do is sit on the edge of the bed, and then we're going to go up and we're going to stretch out our shoulders and our neck. And so we're going to reach over the opposite side of our head. We're going to take our down arm, and we're going to make a fist and act like we're pushing it to the floor. I'm not forcing anything. And then gradually, I just bring my head over. We should feel that on this opposite side of the neck. If you feel it on the side that you're pulling your head to, I want you to stop it, because that can be the joints are getting aggravated, okay? So we're going to hold that one as well, 20 to 30 seconds. And then we're going to turn and look over towards our armpit, 45-degree angle, counter pressure down, and pull our head forward. Okay? This stretches what we call the levator scapula muscle. And then we're going to go ahead and do the same thing to the other side. Counter pressure, head over to the side, and then turn our head looking into the armpit and coming forward at an angle. Okay? Those make sense? Simple. Takes you 2 minutes. Takes more time to brush your teeth and floss them. Okay? Then the other ones that I want you to start doing, we're going to go into core exercises. And these are more stability exercises for the lower back. And so if you've had lower back pain in the past, or you want to help prevent that, core is really important. And the core is your abdominal region, it's the diaphragm region, and pelvic floor. And so what you want to do is the first thing that every one of us should learn to do is do what we call an abdominal hollow. And it's where you draw your abdomen in so your abdomen is contracted. So I want you thinking of a string being attached. This is the front side of my stomach, and this is my belly button on the other side. And then there's a string attached to that belly button, and when I contract, it pulls backwards, okay? It also can be like a pelvic tilt. The thing with it is, or every boy's done this, they have all flexed and looked in the mirror and sucked their stomach in to see what they look like. But the thing is you don't want to hold your breath. You want to be able to hold that contraction, but be able to talk, be able to have communication, be able to bend over without holding everything, okay? So that's number one. You can do it as you're driving down the road in your car, sitting in your work seat, picking up something at work. That's critical. As well, when you go to get out of bed, it's got to start here. The abdomen needs to contract as you roll to your side, needs to contract as you sit up. Before you know it, it's going to become subconscious, and that's going to help protect you, okay? So first core exercise. Then the second one that I want you guys to start doing is what we call a plank. And these aren't in your guys' handout there. But what I want you to do is a front plank and a side plank. And so when we're doing these, I initially want you to start off doing these on your elbows and your knees. And so when you start doing this, it's really just raising up so that your back's in a plank. At the same time, before I came up, I drew my abdomen in, did an abdominal hollow, and I tightened my rear together. Those contract the muscles that support your core, okay? If you're not having any pain when you're doing those, or if you do them from your knees for a week, what I want you to do is go ahead and do them from your toes. Same exact thing, drawing your abdomen in and your rear. If there's any pain in your back, you need to stop them, okay? Important that you come see me or see someone professional that works with backs. The side plank is the next one that I want you to do. What I want you to do here is I want you to get to where you're scalloped, kind of in a C-shaped position. And then what I want you to do is you're going to go ahead and come up onto your knees so you're flat in the front, flat down the side. Okay? The down side of your abdomen is going to be really tight when you're doing that one right. Okay? No pain in the back. And then if you're not having any pain, what you're going to do is do the same exact thing from your toes. Contraction, big down low in your stomach. My rear's tightened together and my abdomen's drawn in. Okay? Each of those planks you're going to hold for 20 to 30 seconds, and then you're going to do both sides on the side plank. Okay? Those make sense? All right. Sleeping. The biggest thing with sleeping is sleeping on our back or our side is the best position for you to be in. If you're sleeping on your stomach, you're not doing good things for your lower back, and you're not doing good things with your neck. The reason why is usually the lower back sags more into the bed, and then with our head has to rotate to be able to breathe when we're on our stomach. So we want to try to avoid that, okay? Firmer the mattress, they say, the better. The biggest thing that I have to say when it comes down to what type of mattress is the best mattress to buy, is get something that has a warranty to it. Some of these places that you'll go to, you go in and buy it, and as soon as it's out in the back of your vehicle, that mattress is yours whether it works for you or not. So get something with a warranty so you can try it out for a little while, okay? Positionally, when you're sleeping in bed, the thing I want you focused on here is I want your pillow to give you enough height so that there's an imaginary straight line that runs right down through your nose, down through your chest, and down between your legs. And so if your pillow is too flat and your head's dangling down, you're ultimately going to create neck problems. And if it's too thick for you and lifting up, you're going to get neck problems as well, okay? So think of that imaginary line, and there's different sizes of pillows, and I can show you that one there too, that you can choose from. So there are different heights of pillows out there. The next thing is if you're on your side, what I want you to do is throw a pillow in between your legs. What oftentimes happens is we end up getting in a position where we rotate and twist our pelvis. This ultimately, over time, is going to create a postural misalignment and create more stress and irritation to your nervous system. Okay? So we want a pillow between the legs, good head lift. If we're on our back, what we want to do here is we want to make sure that that arc in the neck is supported. And so we want to have good support underneath the neck. Once again, a flat pillow allows this to have a dead space, and it's ultimately going to cause flattening of that curvature and ultimately lead to neck problems. So a nice pillow to support the curve. If you're having lower back pain when you first lay down as well, you can try stacking a couple pillows underneath your knees. That helps flatten the curve out in your lower back and reduce the stress to the spinal structures in your nervous system. Okay? All right. All right. With regards to the pillow height, you can see these are, I'm big on Tempur-Pedic products. I sleep on a Tempur-Pedic mattress at home, but you can see the height difference for someone who has really broad shoulders. So just check different pillows out and get a high quality one. You know, I have more patients that come in that say they have 13 pillows because they bought a bunch from Costco and everything else and haven't ever found a good quality one. You spend a little extra money up front and they last a long time. Okay? And then the last thing that I want to discuss is I want to discuss attitude. And I say that because that's something that can affect our nervous system. The information that you put into your brain is completely tied to how your body's going to function and work. 70 to 75% of our thoughts are negative thoughts about ourselves, usually. And so it's something that I try to fill myself with positive thoughts, and I try to be energetic, not only to myself, but to my entire family. So if you feel that you don't have positive thoughts about yourself, start reading some different positive affirmations. And if you don't know what an affirmation is, it's different positive thoughts that you maybe say about yourself. And I have a whole list of them in my office, so if you ever want to take a look at them, you can take a look at them. But you know, if I'm having an off day, I go in and I read my positive affirmations, because there's, just like I said, there's a direct tie to how your body's going to function. When we have increased stress in our body because we're not saying positive things to ourselves, or we're having a rough day at work, or our spouse got after us, or our kids aren't cooperating, all that can affect the cortisol levels in our body, which is a stress hormone, and it ultimately doesn't allow for normal digestion to occur, absorption, insulin production. It completely throws the whole body off. So when in doubt, positive things in, create positive things for our body putting out. Okay, negative stuff in, it's going to lead to sickness. It's just the way that it is. Okay, all right. And in closing, what I want to do is I'm not going to do anything dynamic and make everyone go run laps and do exercise outside or anything like that. But what I want you to do is I'm going to give each of you an envelope, and I want you to write your address on there. And then I'm going to give you a piece of paper. And on that piece of paper, it's your note to yourself. And I want you to write something that you want to do to help yourself. What are one of the 5 things that we talked about tonight that you think you can do for yourself? And write it down on that piece of paper, and then we put it into a little tickler file, and then we're going to mail it to you in 6 months. It's going to be around holiday times. And so you're going to be able to look at it and say, hey, I've done what I said I was going to do. Were you in here for more wellness care? Great. Were you eating better? Were you exercising better? Were you resting better? Were you saying more positive things to yourself? So hopefully you guys got something out of coming and listening that can help you. I know they can if you apply it, and it's just a matter of where you want to be on that meter of being your best possibility. Okay? Awesome.